Hello, everyone. Welcome back to the Organon classroom with Dr. Gazala. Here we are with episode 7 of our lecture series for the chronic miasms by Dr. J.H. Allen. In the last lecture, we completed the concept of sora as given by Allen. Today, we start up with psychosis, another miasm given utmost important by Allen, something which he found predominant during his times. Let's dive in further and learn about psychosis. The subversive forces, J.H. Allen's Guide to the Psychotic Miasm. The diagram right in front of you denotes exactly what psychotic miasm is. This is what is the gist of this miasm, right? The word subversive in itself means something which is trying to destroy or damage a structure, something which is done by attacking secretly or in an indirect way. What is that indirect way that Allen has spoken about since the start? He has spoken about the concept of suppression, right? So आगे जाके what we are going to study is how deep this miasm goes and how destructive and dangerous it becomes. And also remember during Allen's time how predominant this miasm was, that Allen ended up saying that sora still comes second, psychosis is what remains as the predominant miasm, right? The core conclusion, thus, is the disease itself is not the ultimate enemy. It is the imprint that is left behind that requires the removal. Right? जब latent sora है तो है. Okay, we always talk about mixed miasm, या mixed miasmatic presentations. Okay, in patients. So if the patient is already soric, okay, या latent sora है, but उसका जो miasmatic diathesis is predominantly a psychotic one, and if it gets mixed with that one, to what you get at the end is something which requires the treatment, not the presenting symptoms or the presenting disease of the patient. So we recognize the true nature of disease. Okay, देखो अपने lectures में अभी तक we have seen this iceberg का diagram multiple number of times. ठीक है, ये this becomes important for us to understand how deep these miasmatic concepts are, how deep our diseases are. ठीक है, इसमें समझना है that the tip of the iceberg that you're seeing, okay, the white thing, it's just the anatomical and the physiological deflections which comes through to us. ओके, फिजियोलॉजिकल एनाटॉमिकल डिफ्लेक्शन जो हम लोग ने पहले पढ़ा था, डिफ्लेक्शंस यहाँ पे इसका मतलब है जिस हिसाब से वो प्रेजेंट करने वाले हैं. सो इट कुड बी एनीथिंग विच कुड बी इन्फ्लेमेशन, इट कुड बी स्टासिस, इट कुड बी स्पाज्म्स, इट कुड बी कन्वल्जन्स. ठीक है, तो जो सारे अपने क्लिनिकल डायग्नोसिस आ जाते हैं covered up in this particular miasm, those become our anatomical and physiological presentation of that disease. That is only the tip of the iceberg. The main thing, how deep it goes, is the inimical or the submersive forces. The inimical or the subversive forces, I'm sorry, and that is the chronic miasm. Subversive, जैसे हमने first slide में define किया, something which is capable of destruction of the structure and that goes around in hiding. ठीक है, दिख रहा है ये पानी के नीचे है आइसबर्ग का पार्ट which you cannot really see it off, so that is something which is happening. तो disease भी progress होने वाला है, it's going to be secretive. Secretive why? Because you can't see the changes with your naked eye, obviously. ठीक है, that is why we give importance to all the subjective and the objective symptoms that the patient has to say. ठीक है, अब ये symptomatology में आता है, we that is तो another different story and that is another different series that we would have later. For now we are going to understand that the life force loses its equilibrium and cannot free itself from this latent stage without an external assistance. ठीक है, disease is the totality of the effects by which we recognize or perceive the action of a peculiar order of subversive forces upon an organism, as said by Dr. Charles J. Hemphill. ठीक है, तो अब ये जो एक्सटर्नल असिस्टेंस है ये कौन देगा? ये एक्सटर्नल असिस्टेंस हम देंगे. हम कैसे देंगे? बाय आर tactful case taking. ठीक है। डिटेल केस टेकिंग जो होता है वो यहाँ पे काम आता है, जब हम पेशेंट की पास्ट हिस्ट्री में जाएंगे, पास्ट क्लिनिकल हिस्ट्री एंड द फैमिली हिस्ट्री, ठीक है, देन इज the point where we can decode the entire miasmatic pool, the miasmatic ecosystem, right? तो बेसिक माइजम जो अपने हैं, सोरा, साइकोसिस एंड सिफिलिस रिमेन्स द सेम। उसमें जो परम्यूटेशंस एंड कॉम्बिनेशंस होता है, दोज कम अक्रॉस टू अस एज मिक्स्ड माइजम। ओके, so miasms can present from functional changes up to total end organ destruction, right? Sora se start hote hue functionally goes to psychosis and then the final destruction in the form of syphilis, right? So single miasm is manageable, but combined miasm जो हम लोग mixed miasms कह रहे हैं वो, so sora and syphilis together forms tubercular, or as Allen calls it as pseudosora. Psychosis and syphilis together form psychosyphilis, ठीक है। सो सिंगल माइजम इज स्टिल मैनेजेबल, बट व्हेन कंबाइंड माइजम्स आर देयर, ड्रास्टिकली इंक्रीज द डिफिकल्टी ऑफ क्योर, ठीक है। तो क्योंकि वहां पे हम ना एक सेट ऑफ symptoms नहीं देख रहे हैं of one single miasm, we are seeing mixed symptoms of two different miasms, एक जो होगा base miasm, दूसरा जो होगा dominant miasm or the active one at that moment of time, ठीक है। तो उससे the cases become difficult to cure, but they are not impossible to cure. The anatomy of the psychotic miasm means the structure of the psychotic miasm. The etiology and origin, Allen calls it as the disease of lust. Right? Do we know, we understand that psychosis and syphilis both are venereal in origin. Okay? So, with the basic definition, if we go back and recap ourselves with the definition of psychosis as miasm is the obnoxious disease causing agent which is inimical to life. ये अपना miasm का basic definition। अब psychosis है तो what will add, venereal in origin, right? Presenting itself or with primary affection of the genitals in the form of cauliflower like growth, right? Abnormal growths, warts, and all types of outgrowths which happen on the surface, especially the genitals, is what is covered under the venereal miasm, that is the psychotic miasm. Okay, so it originates when the will is overthrown by wrong thinking, action, and behavior. ओके, सो द फिजिकल सेंसेशन क्या है, इसका हॉलमार्क है ये, ठीक है। साइकोटिक एक्सप्रेशन का मीन साइकोटिक माइजम का पेनफुल एंड स्पास्मोडिक सेंसेशंस होने वाले, इट्स गोइंग टू बी पेनफुल एंड इट्स गोइंग टू बी स्पास्मोडिक। दिस विल हेल्प यू आउट इवन व्हेन यू आर डूइंग द माइजमेटिक क्लासिफिकेशन और डिफरेंशिएशन ऑफ सिम्टम्स इन योर केस एनालिसिस, केस सॉल्विंग पार्ट जो अपने को प्रैक्टिकल में आता है उसके लिए, ठीक है। होलिस्टिक इंटरफेरेंस मतलब ये अब कौन से और लेवल पे अफेक्ट करने वाला है, it interferes with the entire human architecture, the entire human anatomy, moral, spiritual, mental, and physical, ठीक है। Psychosis is not simply gonorrhea. Allen says that gonorrhea in the initial stage, okay, it will give you as specific urethritis, which represents only the initial and the superficial phenomena. Okay, if as a treating physician you're seeing only this as the disease of the patient, ठीक कि उसको urethritis हो गया है, so I'm going to treat that off, we are making a bigger mistake. Why? Because if that miasm is psychosis, the constitutional enemy, okay, so Allen says that's a deep constitutional development and progression, और जैसे हमने लास्ट स्लाइड में देखा कि वो अपने सारे ही लेवल्स पे अफेक्ट कर रहा है, so it becomes all the more difficult to catch that off. And Allen says that when psychosis is implanted in a rich pseudosoric, that means the tubercular soil, ठीक है, जो अपना माइजमेटिक डायथिसिस के बारे में हमने बात किया था, जो अपना माइजमेटिक सॉइल है, it develops into one of the most formidable enemies on earth, okay, which means it is constantly growing, it is growing at a speed which you cannot catch up, ठीक है। And then at the end what happens, it deteriorates the health of the patient. When the patient is coming up to you, the patient is already lost, राइट, बिकॉज वो प्रोग्रेशन उसका इतना जल्दी हुआ है, इतनी जल्दी स्पीड से हुआ है, ठीक है। तो अपना at that level also when the patient is coming, it becomes a little catchy and you know it can be a little halting for our cure to immediately take place, ठीक है, तो वी स्टार्ट ऑफ विथ व्हाट, वी स्टार्ट विथ डिफरेंट मेथड्स ऑफ ट्रीटमेंट जो हम लोग यूजुअली सीखते हैं, जैसे जिगजैग मेथड ऑफ ट्रीटमेंट हो गया, जो प्रेजेंटिंग सिम्टम्स है पहले वो दे दो, एंड देन यू सॉल्व इट ऑफ टिल द टाइम you are sure that the vital force is now actually exhibiting the proper constitutional symptoms, or the constitutional state of that patient is coming into picture, right? तो ये है हॉलमार्क्स ऑफ द प्राइमरी स्टेज। हॉलमार्क्स ऑफ द प्राइमरी स्टेज का मतलब ये जो चीजें अभी हम लोग पढ़ने वाले हैं ये आपको दिखना ही दिखना है, ठीक है? दैट इज व्हाट इज गोइंग टू डिफाइन योर साइकोसिस इन इट्स फर्स्ट स्टेज, दैट इज द प्राइमरी स्टेज, ठीक है? तो 5 to 10 days का इंक्यूबेशन पीरियड के बाद में व्हाट यू गेट इज ऑफेंसिव smell, presenting the offensive odor which presents with stale, musty and fresh fish brine odor, ठीक है? एकदम जो गंदी सी ओडर होती है ना, व्हेन यू नो दैट समथिंग इज स्पॉइलिंग ऑफ, राइट? रॉटन एग, रॉटन फिश, रॉटन मीट, ऐसी जो स्मेल होती है, दैट इज ऑल इज the hallmark of this miasm. The high mental anxiety with an obsessive desire to frequently examine the affected organ. इतनी ज्यादा एंजाइटी है, एंजाइटी अबाउट द डिजीज, दैट द पर्सन गेट्स इनटू एन ऑब्सेशन, ठीक है? अब यहाँ पे यू हैव टू डिफरेंशिएट वेल बिटवीन अ हाइपोकॉन्ड्रियाक एंड अ पर्सन विद एन एक्चुअल डिजीज ऑफ दैट पर्टिकुलर ऑर्गन, ठीक है? अगेन tactful case taking in this case, the engine of suppression as a concept, Allen has given a lot of importance to this, and this also becomes the basis of a lot of diseases that we treat, right? Even in our previous lectures we have covered suppression in detail, right? तो suppression का basic क्या है? Primary symptoms जो भी होगा, like anything on the skin, any discharge, any localized inflammation, ठीक है, on the outer surface, उसको unscientific methods और local suppressions जैसे कि liniments, ointments, ठीक है, local applications, ये सब use करके you put it in deeper. Okay, so we think that the vital force is cured, the person is cured, but no, it's because suppressing the primary discharge does not destroy the miasm, it weaponizes it. Okay, and what Allen says, that the kinetic energy of the disease is forced inwards, initiating the secondary stage, ठीक है? तो जो primary stage का अपने incubation हमने देखा, right, देखा कि नहीं, 5 to 10 days वाला, and all of it with the odor and how it is going to affect you mentally, उसके बाद में when there is suppression which occurs gives rise to the secondary manifestations, right? तो secondary manifestations में क्या आएगा? Severe stasis of the internal organs, pelvic inflammatory diseases, highly manifested in women, right? अब ये सिवियर स्टैसिस ऑफ इंटरनल ऑर्गन्स क्या होता है? स्टैसिस की जितनी भी कंडीशंस होती है, ठीक है, which means the congestion of the internal organs in general, ठीक है, it leads to venous congestion and impaired organs. क्या हो जाता है? वो system that in itself becomes sluggish and it starts accumulating within the organ, ठीक है? तो जैसे लिवर का होता है chronic passive congestion of liver, right? then congestive splenomegaly हो गई, then there is portal hypertension with venous stasis, congestive heart failure, portal hypertension, venous thrombosis, and edema, pathological conditions जो है, they are also a consequence of psychosis in general. तो edema हो गया, hypoxia हो गया, hemorrhage, atrophy, fibrosis, organ dysfunction या failure, they all come under the secondary manifestation of this miasm. So Allen says that it occurs when the primary stage is actively suppressed or left without constant proper treatment. The disease moves from a superficial mucosal expression to deeply seated internal stasis, right? अब secondary manifestation भी हो गया और suppression हो गया, and then comes in the tertiary destruction, ठीक है? Now what is this tertiary destruction? 1 to 3 years it's going to take around, that the tertiary stage becomes evident within 1 to 3 years of suppression. ये timeline अपने को एलन देते हैं, in which he says, because वो immediate दिक्कत नहीं आएगा, है ना, it's taking destruction at the basic level, so it is obviously going to take time to move up, to shake up, to disease the foundation of the man in as a whole. Okay, so systemic spread उसके बाद में like gouty concretions in the joints, severe afflictions of the heart and stomach, right? Mental collapse, severe mental aberrations, means severe mental changes like mania and insanity directly traced to miasmatic suppression. If not cured, these destructive manifestations may last the patient's entire life. ठीक है? So the generational toll and the chain of infection. यहाँ पे again comes in the law of inheritance that Allen speaks about repeatedly in this book. Okay, so as per Allen, 80% of the adult male are affected. The majority of married women suffer from suppressed or imperfectly cured forms leading to pelvic affections, rheumatism, or chronic gout. Eventually, children born of infected parents invariably manifest the disease, right? So the pediatric presentation then, okay, when the child is born to in such a psychotic background, with such a psychotic background, uski presentation kya hogi in the pediatric age group according to JH Allen is ophthalmia neonatum. ठीक है, if the child does not escape the primary manifestation, the sour physiology, the entire child smells sour, no amount of bathing sweetens it. Snuffles, specific rhinitis appearing days after birth. Nose is dry, stopped up. Child screams with anger when attempting to nurse with mouth closed. Bowels greenish, sour smelling, slimy, mucousy diarrhea. ठीक है, देखो अभी now whatever we are studying over here is exactly how it is given in the book. ठीक है, ये चीजें हम केस टेकिंग में भी पूछते हैं, राइट? वी आस्क फॉर द टाइप ऑफ nasal discharge, we ask for the type of bowel movements, we ask for perspiration, we ask for any specific body odor and all of it. तो ये सब पूछने का मकसद क्या होता है? The reason to ask this up, the reason for all this thing to be included in case taking is to diagnose the patient miasmatically, उसका constitutional diagnosis ढूंढने के लिए. ठीक है, अपने को मालूम है there are two types of constitutions we generally practice while we are doing homeopathic case taking. The first is the clinical one, okay, based on the clinical symptoms and associating it with the knowledge of medicine. ठीक है, practice of medicine. And the second one is the state diagnosis or the constitutional diagnosis, which becomes the homeopathic diagnosis, okay, for that particular patient. Or in dono ka amalgamation, in dono ka combination is what works best to find the simillimum for the case and to get the prognosis of the case. So the diagnostic focus, how do we identify a psychotic colic? Okay, if the infant escapes ophthalmia neonatum, they almost invariably suffer from this specific severe colic. Standard flatulent colic, standard indigestion, general abdominal discomfort, response to typical soothing. Psychotic colic क्या होगा? The pain is severe, comes in sudden, paroxysm, intensely spasmodic. ठीक है, याद है हमने हॉलमार्क ऑफ साइकोसिस में पिछली स्लाइड्स में देखा अपना पेन कैसा है? इंटेंस है, पैरोक्सिज्म है, स्पास्मोडिक है. ठीक है, so the pathognomic sign is the gas is frequently expelled from stomach or bowels with great explosive force. That's why we always have to examine that patient, even if that's a child, that's a pediatric case with us, we are going to examine it well enough. Just because we are homeopaths and we do all this constitution miasm kind of a thing, that does not mean you're going to rule out general examination and systemic examination. Okay, that along with the knowledge of medicine is required for us to treat that patient and to actually identify it as a miasmatic complaint. ठीक है, pediatric age group में colic is very common than you can think, extremely common. और उसके बहुत सारे reasons होते हैं, but when you can come around to one particular reason like this, the pathognomic sign, ठीक है, it becomes easier to treat the little child. अभी pediatric age group में ही the modalities of infant psychosis, what are these? The aggravations and amelioration. ठीक है, aggravation में क्या होता है? Application of heat, it provides only temporary deceptive relief. All foods aggravate greatly after initial ingestion and mother's milk. Okay, when the patient complains, when the baby's mama is complaining, that the child is not ready to take her milk, the child is not ready to be breastfed, it gets complaints, it gets issues, it is pointing you out towards this psychosis in that infant. Okay, ameliorations क्या होगा, heart pressure, child lying directly upon the stomach, being carried about in the arms of the nurse, gentle shaking or rocking. ठीक है, ये सारी चीजें ना, this actually all relieves the colic. ठीक है, the mother, the parents will complain कि बेबी को जब उठाते हैं और सीधा रखते हैं तो बेबी चुप हो जाता है, जैसे ही उसको बेड पे रख देते हैं और ऑन एनी सर्फेस इट स्टार्ट्स क्राइंग टुगेदर. ठीक है, क्योंकि उसका सिस्टम ही पूरा स्पाजम में जा रहा है इन दैट particular state. Okay, so when you change that, when you hold up the child, when you carry the child, when you gently shake or rock it off, those spasmodic paroxysms are ameliorating, they are settling. ठीक है, तो ये सब जाता है अपने psychotic miasm की तरफ in infants. All right. So the therapeutic mandate, what is it? We must treat it not only from the etiological or pathological point of view, but we must study it carefully from its therapeutic side. ठीक है, because there's a disease there is also a cure, that is what Allen means to say. तो जब हम psychotic miasm पढ़ रहे हैं, we are not studying it only to learn about its pathology all the time, destruction, outgrowth, abnormal growth, ye pain, ऐसी sour smell and all of it. We are learning it so that we know it clearly that this also has a therapeutic side. इसको हम correlate कैसे करेंगे with our materia medica? Okay, so the history of parents will reveal the imperfectly cured psychosis. True cure requires abandoning local suppression in favor of treating the deep internal subversive force. So the clinical arsenal and required potency remedies, like now these are the indicator remedies. ठीक है, ऐसे केसेस में जैसे इन्फेंट कोलिक वगैरह जो हम लोग ने डिस्कस किया, लाइकोपोडियम अर्जेंटम नाइट्रिकम, ठीक है, इंडिकेटेड फॉर पेरोक्सिजमल कोलिक एंड एक्सप्लोसिव गैस, एंड कैमोमिला रूम जैसी मेडिसिन फॉर sour greenish diarrheas and the sour smelling child. Okay, potency as given by Allen is the centesimal scale. The CM potency, highest potencies are required. You will get 10 times more prominent action in these deep chronic diseases from a single powder of the CM potency than from the lower doses. ठीक है, जितना ज्यादा dilution उतना ज्यादा dynamization, जितना ज्यादा dynamization उतना ज्यादा chances of cure. Okay. Now, this is the handout which is available on our Instagram handle at the Organon Classroom. Please follow up that channel for announcement and such handouts as well. ठीक है, this forms the basis for your last moment revision. It covers everything. कैसा stubborn persistent miasm है, primary, secondary, tertiary states क्या होने वाली है, what are the conditions that coming in through, what is the result of suppression, and the clinical hallmarks and manifestations. How is this psychotic child going to be? See, this can also come as an SAQ for you, the psychotic child. So, whatever notes you might be having, you can add up the pointers that we just discussed and the concept of this miasm in your notes and make it the best answer. The therapeutic approach, how are we going to give the high potencies and free the life force from the miasm? Okay, now that's quite an illustrative handout. With this